washing your hands is your first line of defense. It's definitely more important than ever with the pandemic of coronavirus. Hi, I'm Samantha Hill. I'm cardiac surgeon in downtown Toronto, and I'm president-elect of the Ontario Medical Association. The optimum time for hand washing is at least 20 seconds. The first thing that you want to do when you're washing your hands is use your hands to turn on the faucet. It's important to remember that you've now used dirty hands to turn on the faucet. You're going to wet your hands, and then you're going to reach over and grab some soap. And your soap should be enough to cover the surfaces of both hands. The temperature of the water should be warm, not too hot, not too cold, something comfortable for you. You then take that amount of soap and you put your fingers in it on both sides. You then use the fronts of both hands and you rub palm against palm, either in a circular motion or in a back and forth motion. What's important to remember here while you're doing this is that you want to get in between each of your fingers. This motion is a good motion to do them all at the same time, and then you want to do the other side. Having done this, you then turn your hand over and you do the back of one hand. Again, circular motions over the flat part of your hand, up and down a little bit to get the fingers, and then in between each of the surfaces, not forgetting your thumb and the space in between it. And then you do your other hand, same concept. You just rub slowly, nice circles over the palm of your hand, back and forth to get the back of the fingers, and then in between each of the fingers like this. At this point, you're almost done. You're going to want to go around each of your fingers individually to make sure you've gotten all of the surfaces of the fingers, and then you're all done. You're going to rinse your hands under that warm water. Make sure you get all the soap off because it can be quite abrasive if you leave it on. Use a paper towel to dry your hands. Make sure your hands are nice and dry, and then use that same paper towel to turn off the faucet. Over the course of the day, we touch millions of things. We touch our face, which we shouldn't. We touch chairs, we touch pens, we touch our phones, which are dirtier than anything else in the world. We touch money, and the best defense against that is to wash your hands and reduce the population of all of the microorganisms that currently swarm there. It's important to wash your hands to prevent the spread of every virus and bacteria, including the coronavirus. And your hands become the vector by which the bacteria, the viruses, the germs move from one place to the other. You should wash your hands after every contact with another person or with a surface that might have been dirty. You should wash your hands definitely before you eat. You should wash your hands probably before you pick up a phone and put it to your face. Anytime your hands are going to be near your face, you want them to be as clean as possible. Soap doesn't actually kill germs. What soap does is it creates little bubbles that carry with it oil and grease and other things, and the bacteria and the viruses get trapped in those bubbles. So the friction allows you to pick up more of the dirt that's on your hand, and then when you rinse it off in the water, the dirt and the germs rinse off with the water. A lot of people have sensitive skin, and so I would say the best soap to use would be the soap that you tolerate the best and that you like the scent of the best. The best temperature water to wash your hands with is one that is comfortable to you. Slightly warmer water is better than colder water because the oils in the environment liquefy at warmer temperatures, and so the soap works more effectively. When you're washing your hands with soap and water, particularly if you have reasonably tight-fitting jewelry, the soap and the water aren't going to get in there, and the friction from your hands isn't going to affect it. Jewelry actually lodges against your skin and is a great place for bacteria and other germs, viruses, whatever, to climb in between the jewelry and the skin, and so it lodges on your skin. So you're creating a little pool where the bacteria and the viruses can happily replicate, and that's probably not the best thing. With long nails, the key is to try and get underneath the nails and make sure that you clean out all the dirt. In washing your hands, you decrease the population count on your hand, render them clean, protect yourself if you happen to touch your face or go to eat something after that, but you also protect your neighbors and friends by not carrying things from one person to another.
I'm Dr. Harold, and today at DEV we're running a seminar about how to scrub and get gowned and gloved for surgery. The concept of scrubbing is that what we want to do with the scrub, the purpose of it, is that we want to reduce our resident bacterial flora on our hands. And so we're not making our hands sterile, but we just want to reduce the normal bacteria that live on our hands. And so that's usually done with a 5-minute scrub procedure. And what we don't want to do, so some concepts that we don't want to do, is that we don't want to scrub so hard that we're excoriating the skin, because that will bring some bacteria from the inside to the outside, or it will promote the growth of bacteria in those wounds and stuff. And so though we want a thorough scrub, we don't want a vigorous or hard scrub. When we're scrubbing, we want to think of our fingertips and our hands as the most clean or the most sterile. And so when we're scrubbing, we're going to move from the fingertips and the palms down to the elbows. And so think of clean to dirty. And you always want to go from clean to dirty and not dirty to clean. And so once you're done scrubbing, you rinse in that same concept. And so when you rinse, you want to rinse so that you're rinsing the water from the cleanest portion, your fingertips, to the dirtiest portion, your elbows. And so you want all the water to run in that direction. And the same concept for when we're done rinsing and scrubbing is that we want to dry our hands in that manner as well. So we want to dry from clean to dirty, and then use the clean part of the towel and clean to dirty, essentially, and then drop the towel. And we'll go through that as a demonstration. Also, when we scrub, again, we do a 5-minute scrub, and so put a timer to start. However, the concept of scrubbing is that what you want to do is break up your fingers into 4 surfaces, basically the lateral aspects, or the inside or the outside, and the front and the back. And I generally do 20 strokes on each of those surfaces, okay? And then you want to break up your palm into palm, and the sides, and then the back of it. And then your forearms, again, into 4 quadrants, and do 20 scrubs on that. And so that's how you go through the rest of the scrubbing. And then you switch hands and do that on the side as well. And so all your fingers have 4 surfaces, your hand has 4 surfaces, and your forearms as well have 4 surfaces. Before starting to scrub, you want to just do a general hand wash, except you want to include your forearms in it as well. What you want to do is not touch any of the surfaces. We obviously have automated water signaling, and you don't want to touch the faucet. If at any time you do end up touching it, you just restart the scrub at the 5 minutes over again. What you want to do is keep your elbows sort of separated and away, and hold it like this, again, so that everything runs from cleanest down to dirtiest rather than the opposite direction. So you never want to drop your hands down below your waist or your elbow.
Can I ask you a dumb question?
Mm-hmm.
So are we doing one whole arm before going to the next arm?
We rotate, and so what I will do is do the cleanest first, and so fingers, hands, and then fingers, hands on the opposite side, and then forearms, and then forearms. And then my second scrub, I will do just one whole hand, and then just one whole arm that way, but cleanest to cleanest first. And so just get moist, and again, do a general hand wash. And so, as you guys know, our scrub brushes have a nail pick in them. And so what I usually do, I have short nails, and so I generally do not need to pick, but you want to open it so that it stays clean and doesn't touch any surface. And then set it up there so that you can just grab your brush. I do, even though my nails are short, I do pick under each one at the first surgery scrub of the day to make sure that they're clean.
Should we have our sleeves rolled up too?
Yes, you should. And so the sleeve should only come to within about 3 to 4 inches of your elbow. And so if you're wearing an undershirt under your scrub, it should not extend beyond your scrub sleeves. I am short, and so my sleeves go all the way to my elbows, and so that's why they're rolled up. But you don't necessarily have to, depending upon how your scrub top fits. Okay. Whenever you have an instrument that you're done using, just drop it into the sink, and so don't set it down, but just drop. With these scrub brushes, they work better if they are wet, and so initially what I'll do is I'll wet it down. And part of the bacterial killing with this scrub solution is contact, and so I will, again, lather my hands up and then lather my forearms so that it has contact with my hands while I start the scrub, okay? Before this, I forgot, but you want to start the timer so that this is the start of my 5-minute scrub, okay? For my fingertips, and so remember we said to divide the fingers into 4 surfaces, but I start actually with a vigorous scrub of all the fingertips. And again, 20 strokes in my head because it gives you something to do while you're standing here and scrubbing, basically. And then start the surfaces. So Julie, this is where you asked about scrubbing the arms first. So I switched to the other hand now. And so I'm starting the scrub over, but I haven't scrubbed my forearms yet. And so the first scrub, I scrub my hands to make them most sterile before I go to the forearms. So I will switch hands, and then I'm going to go to scrubbing my forearms, again in 4 quadrants. If you find that your sponge is dry, you can get it wet again. If you can get that thing. And so my timer says I'm at 5 minutes right now, but I want to finish my scrub. And again, what you want to do is rinse from your fingertips to your elbows so that the water runs down from the cleanest to the dirtiest. And you want to hold on to your sponge until you're done using it. If you have not reached the 5-minute mark, you can restart a second scrub, just like you did the first time. When you're done scrubbing and you do your final rinse, you can just drop your sponge into the sink without touching or contacting anything. What you want to do is allow the water to drip from your fingertips to your elbows, and so don't shake the water off. Because you should already have your gown, gloves, and sterile towel open, and the way that you sterilely dry off is that the towel is folded in such a way that you can just grab the top or the tip of it. You want to drop the towel and open in front of you so that it's not touching your scrubs in any way. First, what you want to use is use just the top half of the towel. And so in my right hand, I'm going to dry off my left hand, and you want to dry off by patting, again, starting at your fingertips and moving down to your elbows. And again, you want to keep the bottom of the towel from touching yourself or anything else in the room. When you're done with that, what you're going to do is take your left hand, and you're going to then move to the unused portion of the towel sterilely, flip it this way, and I'm going to use my left hand to then dry off my right hand by patting. And again, taking care not to allow the towel to touch the front of your scrubs or anything else. Okay, and then when you're done, just drop the towel in front of you and hold your hands up again. You want to take your gown, and so these gowns are folded in such a way that the inside of the gown should be facing you. And so as you grab the gown, you just want to drop it and unfold it, and the inside should be facing you. And so just put your arms through the armholes. As such. And it doesn't have to fit nicely. And so your assistant will, of course, if I could enlist you, help to put your gown on and secure it. But all you have to do is make sure that, again, the front of the gown isn't touching anything else, your gloves. And so the method of closed gloving is such that now on the outside, everything is sterile. And so you've scrubbed your hands and you've made them clean, you've reduced the bacterial population, but now you're sterile, and you want to only touch things that are sterile. And so your gloves are already open here, and they should be open in such a way that, again, they're entirely work through the cuffs and sleeves of your gown. And so you never want your fingers to peek through, because those are not sterile. They're clean but not sterile. You want to open up your gloves so that they're in the right position. Again, left is on the left and right is on the right. You want to take care not to allow your gown to touch anything, and so you want to step back a little bit. The method of closed gloving can be a little bit tricky for newbies. What you want to do is take the right hand glove and actually hold it so that your palm is up. And so my right hand palm is up in the cuff. You want to lay it so that the fingers are pointing toward my elbow. And so I'm basically laying the palm of the glove to the palm of my hand, okay? And so it seems a little bit backwards in terms of the way that we're putting it on. When it's like this, what I want to do now is through the sleeve, my right hand is going to grab the lower half of the cuff, and my left hand is going to grab the upper half of the cuff to open up the glove like this. And then I'm just going to flip it over my hand as such. Okay. It does not have to be perfect. It can be like this until you are completely sterile and gloved, okay? And so I've left my hand here, okay? I'm going to do that same thing on the opposite side again. My left hand is palm up. I'm going to put the palm of the glove with the fingers facing me. My left hand grabs the lower half of the cuff, and my right hand the upper half of the cuff. And I'm just going to flip it over and flip my fingers into the cuff, okay? So again, doesn't have to be perfect. Now that I'm entirely sterile and covered and my fingers cannot accidentally sneak through, I want to finish the gloving. So you can do so by pulling your surgical cuff down and your glove, that my thumb, straighten out all your fingers, okay, so that it's comfortable. And so the cuff of the gown is still within my palms, all my fingers are through, and now I'm entirely sterile, okay? When you're sterile, what you want to do is obviously try not to touch anything sterile. You can do so mostly by going like this, so that you avoid touching anything sterile. When you're in the surgical suite, anything from the waist down is considered not clean. And so if you're at the surgical table and say the cautery drops down below your waist, that's considered not clean or not sterile. We would trade out the cautery in that method. When you're passing in the surgery suite, you want to try to pass not facing other people. And so let's say that there were two surgeons in the surgical suite, or a surgeon and an assistant. If we were to pass behind the surgical table, what we would do is turn back to back to pass, so that we don't inadvertently touch the other person as we're passing by. Again, because our front and the waist up is considered the most sterile, and obviously our hands are considered most sterile. Okay. If we were to contaminate our gloves, we would want to change them out. Okay. We have two options for this. One is that we can glove over our current gloves, and we would do that with an open technique. And so I think there's some gloves over there. If you could open the 6 for me. And so the 6 is a larger size glove than what I ordinarily wear, because I'm going to put it over my 5s. This does not have to be done in the closed manner, because my hands are still sterile. It's just I might have a little poke in the fingertip or something. And so this we glove in the same way that we would if we were not sterile. And so we want to grab the cuff sleeve, again, put our fingers through, and then bring it down in that way. Slip our hands through here, bring it down here, and that way. Okay. The other option is that you can remove your gloves and re-glove with just a new pair of gloves. And the way that you want to do that is you want to have an assistant remove your gloves sterilely. What they're going to want to do is grab the cuff of my gown, because our goal will be to get back to where you started. And so if you think about me having just finished scrubbing and just putting on my gown, I'm exactly in that same position. And so I need to, again, close glove. And so I'm entirely sterile, and I don't want my fingers to peek through, so I'm working through the sleeve of the cuff. You guys probably should practice closed gloving. It's hard at first. It's a little bit challenging to get the coordination through, but you can practice with the same pair of gloves and refold them and stuff like that. You don't necessarily have to have, a gown or sleeves on, but you can make it, mock it, essentially. Okay. Any questions? Okay. All right. We are all done then.
Today's video, we are going back to the basics again.
I'm Dr. Harold, and today at Dev, we're
washing your hands is your first line of defense. It's definitely more important than ever with the pandemic of coronavirus. Hi, I'm Samantha Hill. I'm cardiac surgeon in downtown Toronto, and I'm president-elect of the Ontario Medical Association. The optimum time for hand washing is at least 20 seconds. The first thing that you want to do when you're washing your hands is use your hands to turn on the faucet. It's important to remember that you now use
as new staff members who
you're going to wet your hands, and then you're going to reach over and grab some soap. And your soap should be enough to cover the surfaces of both hands.
Staff members who are being called to work in an environment like long-term care where there may be COVID-19 cases circulating, it is very important for staff members to understand how COVID-19 is transmitted so that they can take the appropriate precautions. In this video, we're going to be talking about personal protective equipment that is needed in the long-term care home and how this equipment should be donned and doffed in order to prevent self-contaminating with COVID-19 and prevent transmitting it from one resident to the other or from one staff member to another healthcare worker. COVID-19 is transmitted via contact and droplets. It is not an airborne infection. The most important issue when we are caring for residents in a long-term care home is ensuring that we are performing hand hygiene every time we are interacting with the environment or caring for residents. And to work in an environment like long-term care where there may be COVID-19 cases circulating, it is very important for staff members to understand how COVID-19 is transmitted so that they can take the appropriate precautions. In this video, we're going to be talking about personal protective equipment that is needed in the long-term care home and how this equipment should be donned and doffed in order to prevent self-contaminating with COVID-19 and prevent transmitting it from one resident to the other or from one staff member to another healthcare worker. COVID-19 is transmitted via contact and droplets. It is not an airborne infection. The most important issue when we are caring for residents in a long-term care home is ensuring that we are performing hand hygiene every time we are interacting with the environment or caring for residents, and that we have our universal mask in the appropriate position, and that we refrain from touching our mask, adjusting it, or touching our face or eyes.
Universal masking with a medical mask is mandatory for all healthcare workers. Fabric masks are not medical masks. Before donning your mask for the shift, consider drinking water to keep from getting dehydrated. Remove any items not required for the delivery of care, such as watches, badges, necklaces, and rings. These are the steps to safely donning and doffing with your universal mask. First, clean your hands. No jewelry should be worn on the hands or wrist, and nails should be free of nail polish or artificial enhancements. Using an alcohol-based hand rub or hand washing using soap and water, ensure full coverage of the hands, paying close attention to the nail beds, finger webs, knuckles, back of hands, thumbs, and wrist. A full 15 seconds is the minimum amount of time required to perform hand hygiene. Next, pick up your medical mask by grabbing the ear loops. Place the mask on your face with the wire over the bridge of the nose and use your index fingers to mold the metal strip along the sides of the nose and cheeks. Ensuring a proper and comfortable fit now is important to keep the mask in place so you don't touch it. Clean your hands after donning your mask. Once your mask is on, minimize all contact with the mask. If you need to adjust your mask during the course of your shift, ensure you clean your hands before and after doing so. When you need to doff your mask for a break, disinfect the surface on which it will be placed, or alternatively, use a tissue, paper towel, or other clean surface to safely store your mask. Clean your hands. Remove the mask by the ear loops, slowly and carefully, to prevent contact with the outside of the mask. Place the mask onto the surface with the outside facing down. Clean your hands. In summary, don't forget to clean your hands before and after your hands come in contact with the mask. Now we will talk about the steps required to don personal protective equipment used for droplet and contact precautions. Droplet and contact precautions are initiated by any healthcare worker who observes there to be a change in respiratory status of the resident. This means that the resident has developed a new onset of symptoms such as a sore throat, cough, fever, or runny nose. This is not an exhaustive list of symptoms. A sign is immediately placed on the resident's door to alert staff of the personal protective equipment that is required whenever entering the room, which includes the use of a mask, visor, gown, and gloves. First, clean your hands. You will already be wearing your medical mask. Put on your gown, ensuring that the opening is at the back and that the back is covered with the neck and back ties secured. Put on eye protection securely, being careful that your hands do not come in contact with your eyes. Put on your gloves. You are now ready to provide care for a resident on droplet and contact precautions. After providing care to a resident on droplet and contact precautions, you are ready to remove your gloves, gown, and eye protection. First, exit the resident's environment. Remove the gloves using glove to glove, skin to skin technique, and throw them away. Perform hand hygiene slowly. Ensure full coverage of the hands, paying close attention to the nail beds, finger webs, knuckles, back of hands, thumbs, and wrist. Next, untie the neck and back ties of the gown. Remove the gown slowly by touching only the inside of the gown while facing the linen hamper or garbage. Slowly roll it away from your body into a ball, placing it into the hamper or garbage. Clean your hands. Now you are ready to remove your eye protection. Go to the designated eye protection storage area, reach the back of the head, and carefully remove the strap while leaning forward. Do not touch the front of the eye protection. Place the eye protection at the designated dirty area and clean your hands. Don a new pair of gloves and use a disinfectant wipe to clean the eye protection. Place the eye protection in the designated clean area. Remove the gloves and clean your hands. Reusable eye protection can be cleaned and reused day after day until damaged or broken. Disposable eye protection is to be used by the same person for the entire shift and then discarded. In an outbreak unit, if your next task is seeing another resident, you can keep your gown, mask, and eye protection on. Remove gloves, clean hands, and don a new pair of gloves before entering the next resident's environment. Remember, gown and gloves should never be worn at the nursing station. In non-outbreak units, remove your gloves, gown, and eye protection when finished providing care to the resident on droplet and contact precautions. Take-home messages. Hand hygiene is the most effective way to prevent the transmission of diseases such as COVID-19. Universal masking protects you, residents, and your colleagues. Stay home if you are sick. Gown and gloves should never be worn at the nursing station or in the staff bathroom. Gloves must always be changed and hand hygiene must always be performed when moving between residents. Keep your hands away from your face. If you must adjust your mask or glasses or touch your face, clean your hands before and after doing so. Always clean hands before and after eating or drinking. Anything that enters a resident's room must either be left in that room or cleaned when it is being removed from the room before it is used for another resident. Examples of this would be supply carts and vital signs machines. Ensure your workstation is kept tidy and free from clutter.
Recommended steps. Putting on personal protective equipment PPE. 1. Perform hand hygiene. 2. Put on gown, tie neck and waist ties securely. 3. Put on mask/N95. Respirator, place mask over nose and under chin, secure ties, loops or straps, mold metal piece to your nose bridge. For respirators, perform a seal check. 4. Put on protective eyewear, put on eye protection and adjust to fit. Face shield should fit over brow. 5. Put on gloves, taking care not to tear or puncture glove. If a gown is worn, the glove fits over the gown's cuff. For more information, please contact Public Health Ontario's Infection Prevention and Control Department at ipac@oauc.ca or visit www.publichealthontario.ca. 34521. DABC recommended steps. Taking off personal protective equipment PPE. 1. Remove gloves. Remove gloves using a glove-to-glove, skin-to-skin technique. Grasp outside edge near the wrist and peel away, rolling the glove inside out. Reach under the second glove and peel away. Discard immediately into waste receptacle. 2. Remove gown. Remove gown in a manner that prevents contamination of clothing or skin, starting with waist ties, then neck ties. Pull the gown forward from the neck ties and roll it so that the contaminated outside of the gown is to the inside. Roll off the arms into a bundle, then discard it immediately in a manner that minimizes air disturbance. 3. Perform hand hygiene. 4. Remove eye protection. Arms of goggles and headband of face shields are considered to be clean and may be touched with the hands. The front of goggles/face shield is considered to be contaminated. Remove eye protection by handling ear loops. Sides or back only. Discard into waste receptacle or into appropriate container to be sent for reprocessing. Personally owned eyewear may be cleaned by the individual after each use. 5. Remove mask/N95 respirator. Ties/ear loops/straps are considered clean and may be touched with hands. The front of the mask/respirator is considered to be contaminated. Untie bottom tie then top tie, or grasp straps or ear loops. Pull forward off the head, bending forward to allow mask/respirator to fall away from the face. Discard immediately into waste receptacle. 6. Perform hand hygiene. This is an excerpt from Routine Practices and Additional Precautions in All Healthcare Settings, Appendix L, and was reformatted for ease of use. 4. B. E. 65. 21. A. C. ABC. AB ABC. D. One. Mains. On disinfect.
Comment le équipement de protection individuelle. Comment le mettre en 5 étapes simples. Protégez-vous, protégez les autres. 1. Mains. Point milieu. Lavez-vous les mains avec un désinfectant pour les mains ou à l'eau et au savon. Blouse. Point milieu. Attachez-la d'abord au niveau du cou. Point milieu. Attachez-la ensuite au niveau de la taille. Point milieu. Assurez-vous de couvrir la peau et les vêtements. 2. Protection oculaire. Point milieu. Mettez un appareil de protection oculaire. 4. Solution de rechange. Mettez un masque N95, s'il y a lieu. Solution de rechange. Appareil combinant masque et protection oculaire. Masque. Point milieu. Mettez un masque opératoire ou un masque chirurgical. 3. Gants. Point milieu. Enfilez des gants par-dessus les manchettes de la blouse. 5. Équipement de protection individuelle. Comment le mettre en 5 étapes simples. Protégez-vous, protégez les autres. Gants. Point milieu enlevez les gants selon la technique gants contre gants, peau contre peau. Point milieu déposez-les dans la poubelle. 1. 2. Blouse. Point milieu détachez-la au niveau du cou, puis au niveau de la taille. Point milieu insérez les doigts sous la manchette opposée puis faites passer la blouse par-dessus la main. Point milieu tirez la blouse par-dessus l'autre main avec la main libre recouverte de la blouse. Point milieu retirez la blouse sans en toucher la surface extérieure. Point milieu roulez-la en boule. Surface intérieure à l'extérieur. Point milieu déposez-la dans un panier à linge sale ou dans la poubelle, selon le cas. 3. Mains. Point milieu lavez-vous les mains avec un désinfectant pour les mains ou à l'eau et au savon. 4. Protection oculaire. Point milieu retirez l'appareil de protection oculaire en le saisissant par les branches et déposez-le dans le bac de retraitement ou dans la poubelle. 5. Masque N95. Point milieu retirez le masque en le saisissant par les élastiques ou par les attaches. Ne touchez pas le masque. Point milieu déposez-le dans la poubelle. 6. Mains. Point milieu lavez-vous les mains avec un désinfectant pour les mains ou à l'eau et au savon. Équipement de protection individuelle. Comment le retirer en 6 étapes simples. Protégez-vous, protégez les autres. Wet hands with warm water. For 15 to 30 seconds, steps 1 through 5. Don't forget, steps 6 through 8. How to wash hands with soap and water. 7. Thumbs. 3. Vigorously rub soap palm to palm. 9. Rinse all aspects of hands under running water. IPAC Canada, the smart way to advance infection prevention and control best practice every day. 2. Apply enough soap to cover entire surface of hands. 8. Fingertips. www.ipaccanada.org Octobre 2020. 4. Wash back of each hand with palm of other hand. 10. Pat hands dry with disposable paper towel, then use towel to turn off faucet. 5. Clean your wrists. 6. Space between fingers hands. Dispose of paper towel in waste basket. www.ipaccanada.org Octobre 2020. 6. Les espaces entre les doigts. Chi Canada, la bonne façon d'étendre chaque jour les pratiques exemplaires de la prévention et du contrôle des infections. 1. Mouillez vos mains à l'eau chaude. 2. Appliquez assez de savon pour couvrir toute la surface des mains. 3. Frottez vigoureusement le savon paume contre paume. 4. Lavez le dos de chaque main avec la paume de l'autre main. 5. Lavez vos poignets. 7. Les pouces. 8. Le bout des doigts. 9. Rincez toutes les surfaces des mains à l'eau courante. 10. Séchez les mains avec une serviette en papier en évitant de frotter, puis fermez le robinet à l'aide de la serviette. 11. Jetez la serviette à la poubelle. Comment se laver les mains au savon et à l'eau? Pendant 15 à 30 secondes, les étapes 1 à 5. N'oubliez pas, les étapes 6 à 8.